Hello, I'm Greenbrier Almond, Dr. Harold David Almond's son. I'm reading The Stories of a West Virginia Doctor by Harold D. Almond, MD, and we're going to read Part 2, Unusual Deliveries. A cold night for a delivery. When Lois and I came to Buchanan in 1949, I was fortunate that there was an opening for a young GP like me. Another older doctor had retired recently from deliveries. I liked obstetrics. Part of my obstetrical training had been in the Chicago Clinic Maternity Center, delivering babies in the home. So I thought I would try home deliveries. In 1950 in Upshur County, about 50% were in the home and 50% in the two local hospitals. Our area in Upshur, Barber, Randolph, and Lewis counties near Buchanan in 1949-1950 was poor. Our roads and transportations were not good. Many mothers were unknown to me and had no prenatal care. The temperature this night at the mill on San Run was close to zero, and my Arctics crunched on the snow as I left my Jeep and carried my two bags, one obstetrical and the other my usual all-purpose house call bag, up to the miner's home in rural Upshur County. The mother had received no prenatal care, but she had 7 or 8 other babies. I expected no difficulties, but the house was heated only with 2 fireplaces. There was space between the floorboards, and the wind and cold and some snow blew up through the crevices. The rocking chair was rocked only at right angles to the crevices. It was cold. I couldn't take off my gloves for any length of time. I refused the coffee, as it is a diuretic for me in the cold, and the outhouse was some 60 feet away. I was happy for the mother and for me too, that it was an extraordinarily easy delivery. In 2.5 hours, I started back home. A goat eats my roof. In the summer of 1950, I was asked by one of the older physicians to attend to his maternity patient in Rangoon. He told me the home was clean and the family was good folks. I arrived about midnight. The patient was having good contractions. I lay down to wait and fell asleep. When I awoke, I was startled to see it was daylight. The mother had slowed down her contractions, so I went out to the front porch. There, on the cloth roof of my little Jeep, was the family goat eating the roof. The hole was directly over the driver's seat. I was mad, and my aim with a small rock was good. The goat came down in a hurry. The patient stopped labor, so I returned to the office for a full day of work. About 1 p.m., a telephone call came telling me the baby had arrived. I returned to check the mother and baby. There was very little professional skill needed, and I did not feel much satisfaction since I had not delivered the baby. At the end of the day, I fixed my goat-eaten roof with adhesive tape. A leaky house. It was the evening of March 27, 1950. Money was tight, and I needed the $25 delivery fee to pay some outstanding bills. The patient had 6 children, and I was told she had good contractions. The home was 10 miles upstream from Buchanan. It started to rain when I left the rock-based road, and the last half mile was red and slippery with clay. This necessitated a shift to 4-wheel drive in my little Jeep. The house was small and overcrowded, and the roof leaked badly. I draped my old military raincoat over the mother's bed and went back to my Jeep to rest. It got cold without my raincoat that damp night. 4 or 5 times I started up the Jeep and turned the heater on. The baby came about dawn, and about that time the sun came up. I left my raincoat with the mother. She needed it more than I. Stuck in the snow. Late in November 1950, Upshur County got 50 inches of snow in 2 days. The call requesting help with a home delivery that evening was to Hall, 10 miles downstream. I called my school teacher friend Charlie to accompany me on that snowy night. The road was not plowed, so I drove my Jeep down to Hodgeville, Century, Volga, and Boulder, and back up to Hall. It was bitter cold, only 10 degrees, and the wind was still blowing. The tenant farmer had used his team and a homemade wooden plow to clear the last half mile to the farm. I was in a hurry on this last half mile, and the Jeep slipped off over a small bank. The Jeep wouldn't go forward or backward. Neither Charlie nor I had time to use the shovel. We ran down the lane and entered the old farmhouse just when the last of the kerosene was used up. The fireplace provided the entire light and heat. I asked for a kettle to boil the needle and syringe, but the single pot was too greasy to use. The mother took a morphine tablet by mouth, and the baby came within the hour. We kept hearing hooves stamping in the next room, so when the delivery was over, I asked the farmer if he would pull my Jeep out of the snowdrift with his horses. "'Tain't horses, only mules." He did harness them up, and with lots of shoveling and pushing, the Jeep came back on the lane. We couldn't turn around, so we backed up the half mile. Charlie wouldn't trust my driving anymore, so he drove back to Buchanan. I thought I would never get warm. An autopsy without permission. General practitioners sometimes perform major surgery in a hurry when an emergency arrives, and because of their training in a first-class medical school, they do very well. Just before breakfast one morning in June 1958, the hospital nurse called and said a maternity patient had had a seizure and would I come quickly. The patient was about 8 months pregnant. She was in the hospital because she had a biopsy of a node in her neck the day before. After her biopsy, her doctor left for a meeting in San Francisco. He had assured me that she was fine, and he anticipated her release from the hospital the next morning. Sensing the urgency of the nurse's call, I hopped in my Jeep immediately and started driving to the hospital, which was nearby. Traffic was not busy, but I saw the light was red. I looked both ways but didn't stop. As I went through the red light, I heard a police blow his siren. I proceeded to the hospital with the chief of police following. I arrived at the hospital within 4 minutes, but just in time to witness the patient have another seizure and die. Thank God for good staff nurses and Mrs. Smith's quick thinking that moment. "I'll help you with the C-section if you are ready." The instrument tray was opened, and I made the first incision through the abdominal wall right to the uterus, and then through the uterus. Within 30 seconds, we delivered a 7-pound girl who cried immediately. I was pleased and somewhat surprised to hear her cries. I had honestly thought we would have to resuscitate the newborn of a dead mother. The phone rang in the room. The chief of police was on the line from downtown where he had been waiting. I told him he could come up to talk with me. When he came up, he saw the bloody mess and saw my cleaning the new baby. I thought he was going to faint. I directed him to a chair. He said that he wasn't going to give me a ticket this time, but asked me not to run a red light in the future. When I looked at the baby, I was happy, but scared to death. The baby was healthy, but I had performed a C-section without anyone's permission. Now I was faced with another dilemma. Should I do an autopsy on the mother? The report from the biopsied node of the mother's neck had indicated an infection. But I, the substitute doctor, had no idea why the seizure and why her sudden demise occurred. I was more curious than scared, so I did a post-mortem examination and took small specimens from the spleen, liver, stomach, kidneys, adrenals, ovaries, and lymph nodes. I must have worked fast because when the Catholic priest climbed the hospital stairs from the parsonage next door, he gave her last rites and baptized the baby. I told the priest I would like to talk to him. I had no surgical permission to deliver the baby. He assured me that he would take care of that little matter. Then I confessed that I had also done an autopsy without permission. I explained I really needed to know why the mother died, and the baby needed to know also. I called the baby's father and told him the good and the bad news. That he was the father of a healthy little girl, but that his wife had died. The autopsy provided the diagnosis: acute lymphatic leukemia, which had spread to the brain. The little girl, now grown up, graduated from college and is an accountant. A joyous, noisy birth. Both the young pregnant mother and her young husband were deaf. They were graduates of the West Virginia School for the Deaf in Romney. Their 4.5-year-old son could hear normally and was bilingual. He spoke English at kindergarten, and to his grandmother, who lived next door, he talked in sign language to his mom and dad. Youngster taught me to sign for "it's a girl" and "it's a boy." He also wanted me to let him know if the baby cried out, so he would know whether his sister or brother was going to be able to speak aloud to him. He came to the delivery room with his mother because his dad was still at work. The smart little guy gave the hospital his mother's name, address, and even insurance information for all the paperwork. I delivered a little girl that joyous day. Yes, she cried aloud, which meant she would be able to speak. Her big brother was excited and happy, for now he had a sister to talk with. He wouldn't even have to run over next door to speak to his grandmother. This was one of the happiest births to which I ever participated. I still remember the sign for "it's a girl," and yes, she speaks English. It was a happy foursome. It was a privilege on my part. A surprise cure for abdominal pain. Early one morning, I answered the telephone at home. A nurse from St. Joseph's Hospital was calling about a young female patient of mine who had come to the hospital with severe abdominal pain. A few minutes later, the nurse met me as I entered the hospital door. She said, "Maybe I'm wrong," but I took her to the maternity floor. The patient's husband, holding their 1-year-old child in his arms, said, "I sure hope you find out what's causing my wife's awful pain." Not long after I arrived at the delivery room, I proved the nurse to be correct in her assessment. I delivered a healthy, full-term infant. After the delivery, I went to speak to the patient's husband. He asked, "Did you find out what the cause of my wife's pain?" When I told him, he could go to the maternity ward and see his new 7.5-pound baby. His mouth dropped and he said, "Doc, you're funning me." During my hospital rounds the next day, the new mother said that she had planned to come in and see why she couldn't lose weight and what was causing that churning around inside me. To this day, I find it amazing that she had no idea that she was pregnant. The Page Maneuver. Dr. Basil L. Page was buried in the West Virginia hills in his 81st year in 1981. The chief, as his friends and doctor colleagues called him, was a doctor's doctor. When the young doctors in Upshur County needed direction, they sought out Dr. Page. The following account illustrates this point and probably has assured Dr. Page as one of the greatest doctors in Upshur County in the 1900s. The sick and troubled in Upshur County never had a better friend than the chief. Everyone recalls and remembers him as a surgeon, and he certainly was outstanding. Dr. Huffman said Dr. Page's eye was located at the tip of his right index finger, for he would locate a diseased appendix in a jiffy, and he plated fractured bones so closely that the x-ray specialist looked twice to see the fracture. Among the young doctors in the late 1940s and early 1950s, the chief was their teacher, especially in the field of obstetrics. Breech births are particularly difficult to deliver, and in this particular type of delivery, the chief helped us enormously. A breech birth, incidentally, is a baby coming with either its feet or breech first, and the head last. About 4 or 5% of Upshur County deliveries have been breeches. The difficulty comes because the head is the biggest part of the baby, and complications occur when the baby's hands slip over the head instead of remaining by the baby's side. One hand over the head is an almost impossible delivery, and 2 hands over compounds the disaster. The Page maneuver is used to correct this impossibility of hands over the head. The baby's hips and upper thighs are grasped with a moist towel, and the baby is turned 180 degrees back and forth until the lower hand either spontaneously returns to its side or can be easily placed at its side. If both hands are above, the 180-degree twist is done again and again until the second hand returns to its place. This maneuver is simple and fast and does no harm to the mother or to the passenger, the little baby. Breech births are not new, for recorded in Genesis chapter 38 is the tale of a woman with twins. The midwife had a double problem, for the one put out his hand, and the midwife took and bound upon his hand a scarlet thread, saying, "This came out first." And it came to pass, as he drew back his hand, that behold, his brother came out. And afterwards came out his brother, that had the scarlet thread upon his hand. Genesis 38, verses 28 through 30, the King James Version. The attendant at that delivery 4,000 years ago must have had anxious moments until the babies arrived. Sister Heriberta said she could always tell it was a breech delivery when the nurse, the anesthetist, and the doctor stopped talking. After the doctors and nurses learned the Page maneuver, it was all chit-chat again. The Page maneuver applies to all God's creatures. Russell Westfall, a well-known local farmer, reported an interesting series of breech deliveries. The first occurred early one Saturday morning in October when a cow couldn't deliver her breech calf. Pulling on the legs exhausted the veterinarian and Russell, so they used the block and tackle. The calf died and the cow was injured. Later on that same Saturday, Russ's son, Lynn's prize cow, was likewise with breech and couldn't be delivered. The veterinarian was on another call at that time, so Russell Westfall, strawberry grower, corn husker, and producer of half-runner beans, turned obstetrician that afternoon. He had overheard me talking about the ease of the Page maneuver, so he thought he would try it. He grabbed the calf's hind legs and twisted 180 degrees back and forth 6 or 7 times, and out popped a calf. Russell says the procedure works, and he only needed ordinary strength. It spoils this story to tell you all that Dr. Page didn't discover this maneuver. He said he learned it some years before from Dr. Bill, But then he was modest, and nobody ever met Dr. Bill. Dr. Page taught this method of breech delivery to the young doctors of St. Joseph's Hospital in 1949 and 1950, and they in turn taught it to others. In fact, only here in this little town in small Appalachian state is this life-saving technique affectionately called the Page Maneuver. This completes part 2 of The Stories of a West Virginia Doctor by Harold David Almond, MD.